Hi there, it's Scott Jamieson here, GP in Tayside in Scotland and RCGP Scotland Executive Officer for Quality Improvement. I just wanted to take a few moments to talk you through an example CPRD Quality Improvement data report and how we have used it in practice to look at our prescribing. This is a sample report and is not containing any patient data of actual patients, but is identical to the type of report that you will be emailed to your practice 2 or 3 times a year. At the start of the report there is an introduction, and before each section it will go through and give the rationale and background behind each of the indicators. The first indicator I'd like to draw your attention to is the prescribing of non-steroidal inflammatory drugs in patients with heart failure. There's clearly a reasonably good evidence base here that giving NSAIDs in heart failure is something that should be done with caution and is not going to be recommended. In this instance, we can see initially at the top, it shows the overall prescribing of this type of medication in the CPRD database and shows your practice's trend per 1,000 patients. Clearly on this, we can see here there's a vision identifier, and this code here can be used in your practice on your vision system in order to bring up the individual patient record. It also identifies the anti-inflammatory which was prescribed. These may be acute prescriptions, they may be long-term prescriptions. In this instance we had 3 prescriptions who were prescribed an NSAID in the period which is highlighted. There is a differentiation between those based on a strict and a broader definition of heart failure, which helps capture more widely some of the other read codes used for this condition. As I said, in each section there is an introduction and rationale explaining why we look at each indicator. In the second indicator, we have the pioglitazones prescribed in patients with heart failure, again something which you ideally wouldn't want to do. In this instance, it's very clear that in your practice, we did not have any prescribed medications at all compared to the average in the practices within the CPRD database. This audit here I found particularly helpful. This was the prescribing of anti-inflammatory drugs to patients with CKD. Sometimes these can be acute prescriptions, for example in gout. Others might be for long-term pain control, such as in osteoarthritis. In each case, we have a vision identifier to enable us to easily identify who the patients are within the practice. However, it is anonymised in that out with the practice, this data is meaningless. It does tell you exactly who the patients are with regards to what medications they are prescribed. As it can see here, your practice overall is going down in this indicator. This is a manageable number of patients to review in a single afternoon in order to verify whether these were long-term prescriptions and whether they merit review. If they were acute prescriptions, a GP could consider adding a warning if this is something they think might recur in the future. Lastly, we have the patients prescribed aspirin only for their atrial fibrillation. You can see here we easily identify the patients through their vision identifier, and we can go in and review those notes in an afternoon to double check exactly of the 175 patients with atrial fibrillation, how many are only prescribed aspirin. Thank you.